introduction. Are you able to hear me now?
Yes, ma'am.
Excuse me. Okay. Actually, I think this all the viewers are like PharmD students only, no? I just want to know like who are the audience and all. That's why whether the PharmD pass out or PharmD the pursuing PharmD like that. Huh? Anyone can reply me
Ma'am,
because I hello.
like including students and postgraduates.
Postgraduates are they? Okay. Uh, thank you for RX doctors for having me here. Actually, it is a great opportunity to interact with our juniors and colleagues for discuss our few like our profession and all those things. So that's why I just want to interact with I'm not here for a presentation or anything. Don't get panicked with my PPT and all. I just want to be a good interaction with you guys. That's why I took this chance. Uh, First of all, I will tell you I will give you a brief introduction about myself because that will give you an idea about why I choose residency. Because today my topic is like oncology residency challenge and rewards for PharmD graduates. So the main topic for me is like challenges and rewards of oncology residency. So before that, I should tell like how I reached in the residency. So I'm not that much a very good expert in this field and all. The thing is like I can share you my experience, like how I gone through and how I reached it at this point, and those experiences I just want to share it with my juniors. That's why. So first, I passed out from the Tamil Nadu Dr. MGR Medical University. I completed a Doctor of Pharmacy degree from that university, and after that, I worked as a clinical pharmacist in Apollo Cancer Center, Chennai. So immediate after my PharmD, I worked as a clinical pharmacist. So being a clinical pharmacist in a cancer center, I realized my knowledge in oncology was it's literally low because I used to feel like my knowledge I have to update my knowledge, then only I will be eligible to become a clinical pharmacist in a cancer center. Because one thing I got a good opportunity for the being a immediate pass out fresher. I worked in a specialty which is highly equipped with what most sophisticated method of treatment. So I was really fascinated with the entire world of oncology. So from there I realized that I should go for because it affects our clinical work also, because a lack of knowledge in the specialty area is literally affecting my quality of my clinical pharmacy services. So that is what I felt. So that's why after that I looked for the postgraduate degree in oncology. So only the residency course, there are a lot of fellowships is also there. I applied for anything. I got it. I got it in JSS for doing the oncology clinical pharmacy residency. So I quit my job and I joined for the residency. So residency program was like a 2 years course. So first year, actually the residency program, if you are searching in online and all, you can see in America, US, UK, everywhere it is having residency programs in different subjects. So actually, JSS is also following almost the similar kind of like curriculum. The first year is completely general things, general medicine, pediatrics, and all those things. Second year, second year completely, we will be posted in our own specialty. That is for me, it is like oncology. So like that, I came to JSS. From JSS, I completed my 2 years. It was JSS. I have completed 1 year. That is for my normal first year rotation. Second year, I was posted in Bharat Hospital and Institute of Oncology, Mysuru. So from there only I completed, like it was like a outside posting. My 1 year was I was posted in Bharat. So from there I completed my oncology, because that is an oncology center. It's an oncology at HCG Bharat. Sorry, my HCG Bangalore. All are familiar. I think all are familiar with the HCG Bangalore branch. So that HCG ka Mysore branch only. That is Bharat Hospital and Institute of Oncology. So from there I got trained in oncology. Then after my residency, I got a job as an oncology clinical pharmacist in Ramaya Medical College Hospital, Bangalore. So currently I'm working as an oncology clinical pharmacist in Ramaya. So being a working professional, I have certain limitations to talk about some logistical things of particular institutions. So I can guide you to get over there, some other institutional based things I can't disclose it. So because I'm working currently, that's why. So that is the thing. So I think we can talk about this residency challenges and rewards. I think it's time to get into the topic. So first, can you please change the slide? Okay. So first question, first we should ask with PharmD graduates, like what after PharmD? Because a lot of people are not having a good clarity, like what to become after PharmD. I think previous session you already got interacted with the PhD scholar and you got to know about various aspects after PharmD. So today, in this, first thing is like clinical pharmacist. Like I know nowadays a lot of these new PharmD pass out people are not that much interested in the clinical side because of the low payment issues and lack of opportunities or lack of job roles in a hospital and lack of the job description, proper job description. These all things are leading to the leading to avoid the clinical side for if we are talking in perspective of a clinical pharmacist or PharmD upcoming like PharmD pass out people. So for me, there's a plenty of opportunities are there after PharmD. Uh, Actually, our PharmD syllabus, our curriculum is completely filled with almost all side of pharmacy in India. So actually, after PharmD, you can go in any side, like whether if you want to go to clinical side or in the academic side or in the research side, you can do n number of jobs. Like you can go into different type of jobs. But the clinical pharmacist is one is very particular for the PharmD graduates. So, but I'm not forcing that clinical pharmacist is everyone's cup of tea. There are people who don't like who is not liking this profession because due to the challenges and all. But there are people who is really passionate about this particular job because of the recognition and while making the interventions and all. If doctors are accepting their intervention, that is something which is very proud. That will improve their confidence. That will they are so much like those people will be so much happy with themselves. So that kind of people will also is there in this field. So first thing is like clinical pharmacist. That is one part. Like after PharmD, we can go. So I'm just simply going through different points. I know you people are already well equipped with these topics and all. So next is like academician. We all know that after PharmD, people are working as lecturer and assistant professor and all. Like so, in that manner, you can go as like academician. Then research scholar is there. Excuse me. Okay. Are you able to hear me?
Yes, ma'am.
So next, like this, what research scholar, you already heard like previous session, like after PharmD, they are pursuing PhD. So that is one option. Another thing is like pharmacovigilance and clinical research. Pharmacovigilance and clinical research is something which is very corporate oriented job, and they will pay you nicely. That thing is also there, but little job stress and that the corporate kind of work setup will be there. So this is the usual things. Can you please change the slide? So next, after this, like next question, like why to become clinical pharmacist? That is the next question. One thing, as I already told, like people who is well passionate about clinical pharmacist job, those people is like they are really finding a way to sustain in the clinical field. That is one point. Another thing is like lack of clarity about streams after PharmD. Because in India, like in our even in our small India, a lot of PharmD students are coming out with without proper internship and clerkship and all. Like, I'm not talking about the clerkship, but at least people are coming out with lack of proper internship, because there are students, they don't know what they have to do in the hospital. So they are totally unaware of the hospital setup, and because that kind of things are there in India, it's still existing in India. So because of that, the students are getting little what hesitant to come towards the clinical side, because they are thinking that they are not what they are not that much equipped with the knowledge to be in the clinical side. Because I was also one among them, because I also felt the same thing. But anyway, that is the truth only. But what I want to tell to the juniors is like, lack of, like, if you are not that much clear about which path you have to take after PharmD, then, and also if you are not that much experienced in the clinical side, like you don't know, you didn't get a proper internship, or you don't know what to do after PharmD, then just go for the clinical side first. Then try the, if you got a very good equipped internship, means from there you will be able to identify whether you are a clinical person or not. There are people who is not that much fond of this clinical side. So at that point you can take your decision and you can change the path. But if you don't know, and what is happening in the clinical side, you don't know what are the things which you have to do in the clinical side. So if you are in that state, I will tell that you just go to the clinical side and just experience what it is there and how the things are going there. Because it might be a very, I don't know whether it will be a wrong statement or something, but the thing is, like, if you're being in a clinical field, it is little easy to move from clinical to research side and clinical to vigilance side and all. But it is comparatively, it is little tougher vice versa, because clinical field is highly evolving and every field is highly evolving. But the thing is, like, in clinic, from clinic, every field like vigilance, research, everyone needs a person with clinical knowledge. So if you are having some clinical experience in your hand, that will be always a positive part. So from clinical to vigilance, it is easy to shift comparing vice versa. So better to start your career with clinical side, then just find out whether that is, whether you are happy there, whether is it okay for you, like, to be in a clinical side. Just experience the taste of clinical pharmacy profession, and just then take a decision. I know certain people are just running away from the clinical side because they are not that much equipped with the proper internship. So they are getting what they are seeing clinical side as something which is very very tougher side, and they don't want to come to clinical side because of the poor internship. So it should not happen that thing. Actually, everyone should experience clinical side properly. Then you can take a decision whether you are a clinical person or not. Then if you are, like, after experience in the clinical field, then if you are not liking the thing, then you can shift your career accordingly, because it will be easy from clinics to research and vigilance and all, by comparing vice versa. Then another thing is like unique role for PharmD graduates, because actually one thing is like, now we know that certain some discrepancies there regarding M.Pharm pharmacy practice and all. But the thing is, like, we all are anyway, the clinical pharmacy profession, the clinical pharmacist is unique for the PharmD graduates. Even because if you're going in vigilance side, if you're going the clinical research side, wherever you are going, you will see n number of other degree people over there. But you can't see other degree people in the clinical pharmacy setup that is only meant for clinical, that are PharmD graduates. Because I started my career as a clinical pharmacist in Apollo. There 24 clinical pharmacists was there in the 200 bedded cancer hospital. So the 24 people are like they were like all are PharmD graduates only. So we worked in a setup where 24 clinical pharmacists who completed doctor of pharmacy degree, then we are working in a setup. So that that particular job, that a clinical pharmacist job, is only meant for PharmD graduate, not other people. So this is the only place which is only meant for you. No other people can replace you here. Then next, can you please change the slide? Next topic is like, next question is, why do we need specialization after PharmD? So this I think I already told you, because I started my career as a clinical pharmacist in a cancer center. So now I become an oncology clinical pharmacist, because I can only talk from my perspective, because I'm not telling that my thought is the correct and all. There are people with different opinions also. Because for me, I will always suggest that whenever, like, if you are getting into a clinic side, the thing is like our knowledge is very important. More than that knowledge, our skill, like we have to develop a clinical pharmacy skill. That is also very important. And anyway, I'm not telling that everyone will come with a lot of knowledge and all, nothing like that. The thing is like, once if you get into the clinical side, you will get that understand about how to behave in a clinical side. What are the skills which we have to update in ourselves? That is the one thing. So this is one next question, like why we need specialization. So for me, I will tell that one is specialty experience you will get, because if I'm getting trained in oncology through oncology residency and all, if I got this residency, then I'm going to a cancer center, means of course I will have that subject knowledge, then it will be easy for me to work as a clinical pharmacist or oncology pharmacist. Because why I'm telling is like, because I worked as a clinical pharmacist in a cancer center, so I realized my lack of knowledge in the subject. So because I used to get posting in BMT and pediatric oncology everywhere. So the thing is like, even I don't know how to see the case sheets over there at that time, to be frank, because they are using a highly complicated regimens, and we are not that much experienced with the complicated oncology regimens and all. So being a PharmD graduate, it was very, very tough to review the case sheets. See, after PharmD, it is very difficult to review the oncology case sheet that everyone might experience, because people who is taking an optional posting during your internship and all in oncology, they might be able to understand, because to understand the regimens and understand the toxicities of the drugs and everything, it is very difficult. So that's why specialization in the particular subject, it will help you to improve the improve your services. That is one thing. Another thing is like preference in job interviews, because now see, I chose oncology. So if I'm going for a job opportunity, or I'm just applying for the jobs, like they will always prefer the person who is having experience in the oncology, because we are applying for such kind of a job. Now I am working as an oncology clinical pharmacist. So when I came for the interview here, they are always asking for the specialization in oncology, because they want to hire a person who for the onco pharmacist post, like clinical pharmacist, oncology clinical pharmacist post. So that's why they are seeking people who is having a specialization in oncology. So here comes your priority. If you're doing some fellowship or residency, something extra other than PharmD, this will increase your value, like increase your job opportunity, and it will make you yourself like you will be an outstanding person from a group of PharmD graduates. So that is one point. So always, if you're having a specialization, it will improve your quality and improve your value. That is another thing. Then more clarity about the subject results in improved quality of clinical pharmacy services. That is, I already told you. Like, the thing is like, if we already know the subject properly, like I'm not telling that we will, after residency or after fellowship and all, we will be well equipped with the subject. No, but the thing is like, after my residency, what I learned is like, I can confidently say this thing, like I know how to read oncology, like I know how to search the things in oncology, and at least while seeing the case sheet, I'm familiar with the things, and I know how to do the interventions. So those things we will be much more what we will get a more clarity about those things, because we know the subject at least little. That much only I will tell, because oncology is like an ocean. So we know the subject from the very periphery. So we will be able to understand what it is going for the patient. So that is the one difference which I felt my clinical pharmacist job and my oncology clinical pharmacist job, because I worked after PharmD and after my residency. So that difference is there. That makes me little happy, because at least now it is not like how I was seeing the case sheet being a clinical pharmacist. Now it's everything changed. Now whenever I'm seeing a case sheet, at least I know something about the case, and I know about the regimens, and I know where to look for the even errors and everything. What are the areas we have to check? Those things I have some clarity. So that will improve our clinical pharmacy services, which we are providing as an oncology clinical pharmacist. So that is one of the positive part of the specialization. Then another thing is like challenges for specialization. Of course, there is a challenges and positive and negatives. It will be there for everything. So the challenges for the specialization, if we are talking in perspective of the residency program, the financial support, because there are people who is not there are people who is having money, but they don't want to spend it for the again residency or fellowship or something, because they are telling like we spend this much money for PharmD, but even after PharmD we are not getting the proper respect, we are not getting the proper payment, they are underpaying you. So because of that, people are not ready to spend again for the specialization purpose. That is one problem. I know that thing. Even I know many people used to ask with me also when I chose for residency, but this it's always a personal perspective, because it depends upon the people. It will change, because I took, okay, whatever be the thing, whenever I'm talking about the salary or something, I used to think myself like whether I'm eligible to be here. Because when I was being a clinical pharmacist, I used to think like my knowledge about my knowledge level. So I used to feel like my knowledge is not good enough to be a clinical pharmacist in a specialty. So I'm not feeling that much guilty or something for spending money for my residency. Actually, that is the truth, because I felt if I want to be in this field means I should grab more knowledge. That, and also of course the experience in oncology is really matters. So that thing is also there. So anyway, it depends up, it might be a personal choice, it might be a personal decision, and a lot of things we have to consider, because we might have to take money from our parents or loans or something. It really matters. I know that's a very important factor, but if you can do it, it will be a positive things. That is that it's not a forceful things, like we can't ask anyone to go for the specialization and all. But the thing is like, if it is okay for you, then you should do it. That is the, it is like a 50-50, that kind of thing. Then time, because almost people, next question is like people will tell like you have already done a 6-year course, then again you are going for a residency, a 2-year course means again you are going to study like that. People will be asking in that manner, people used to ask. But one thing we have to understand is like, this is my thought, because we PharmD people are comparing with MBBS people. Then MBBS people is like 5.5 years, anyway 6 years, 5.5 years MBBS, and PharmD people are 6 years. That is what the all PharmD graduates are talking very proudly. But the thing is like these MBBS doctors, they after MBBS they will go for MD, they will go for DM, and after that only they are becoming a consultant. So if we are taking an oncologist, like medical oncologist or surgical oncologist or whatever, they are going for MBBS. Then after MBBS they are doing their MD 3 years. Again after that they are doing their DM. So after these many years of experience and specialty, super specialty experience, they are coming as a junior consultant. So these much experience they are having, and we PharmD people are going with our internship to the consultant. So you just compare like our knowledge level. Then even if you are taking a junior oncologist, that person is having how many years of experience and how many years of hard work for to grab that degree. So then we are going with a 6-year PharmD. Then we are very proudly we are talking like we studied 6 years. So I used to feel like we also should update like them, because see what I felt in a practical setup, being a PharmD graduate and being a residency person, like there's a huge difference the way how doctors are seeing us, and more than that, our quality of interventions is getting updated. See, when I was a like clinical pharmacist or the PharmD intern, what kind of interventions I used to make is like, because I used to feel a lot of confusion, like whether it is really matters or the drug interaction will be there. So if you are taking a drug case sheets, we know everywhere if you are taking a case sheet, anyway one major drug interaction you might be seeing it. So where we have to intervene or where not, this is one of the very important thing which we used to get it through our experience. So that is one thing. I think excuse me, what happened to the slide? Okay, I will continue. So that thing is there. So always putting time for your degree or your studies, it really worth it. That is what I can tell you. Then another topic is like complexity of the subject. As I already told, oncology is highly what oncology is very vast and with lots of complicated regimens and everything. So the complexity of the subject is also there. So that is also one of the challenge, but it will be a positive for us also. That is another thing. Then continuous learning is there. So in continuous learning, if we are being in a clinical side, like being a clinical pharmacist, every day you will be come up with new like what problems. Like you might be getting a lot of queries in a day. So some queries, it might be very new for you, like even we never heard something like that. So we have to search for it, we have to find an answer. And sometimes if some interventions means, we have to think in a very clinical setup, in a practical way, and we have to take a decision and we have to communicate it to the doctor. So these all things are very challenging things. So in every day, if we want to exist in this field, we have to learn continuously. I'm not telling we should be equipped with what full packed the knowledge, but the thing is like we should be ready to read every day. We should be like, we should ready to face the challenges. That is what I want to tell. Because anyway, I'm not telling that I'm completely equipped with the thing, but one thing is like, I'm okay to go and search for it, okay to learn from it. So just one thing we have to learn from the clinical side is we should learn from mistakes. That is also one thing. We should not repeat the same thing. We should not repeat the same mistake again. So these things which we have to be more careful. So for that, the continuous learning is very important. Another thing is collaboration and communication, because being in a clinical setup, that is, this is not only for the oncology person, this is whoever is working in the clinical field. The collaboration and communication, that okay, if you are going in research side or if you are going in the vigilance side, everywhere the communication and collaboration with other what colleagues and everything is important. But in clinical side means, of course, here one matter will come, because sometimes some people used to tell that they are not respecting clinical pharmacist, or we are not getting proper respect, or sometimes case sheet is not giving. So these kinds of things is working, it's still existing in the clinical side, because nurses will be there, some junior doctors will be there, we will be there. So we should have a rapport with everyone, we should build a rapport. Then so that skill we have to develop it. That is another challenge. Okay, next, okay, importance of oncology specialization. So here, high demand for the subject, that I already told, like oncology is like always growing like a cancer only, because it's a high demand. Because I heard like before also, like just previous session also, people are more asking more about oncology and everything. I think almost all people are very much interested in the oncology setup. So of course, you know that high demand for the subject is there. Then complexity of cancer therapies, because we know that the different regimens, because we are giving highly toxic drugs. So of course that management of toxicities is also one of the very important cornerstone of oncology. So because of these things, we clinical pharmacists have a great role to play over there, because a lot of ADR, a lot of drug related toxicities, everything we are seeing in a day-to-day basis. Then scope in different field other than clinics. Okay, even after residency, like oncology residency, you can go to different field. Like there are, my seniors are working in research side and they are getting a highly paid, they're highly paid there. And even in the vigilance also people are there. So the clinical experience, it will always matter in all other field. Like in clinical field also it matters, and in other like research side and everywhere, the clinical experience and the clinical knowledge and the subject knowledge, these things are always, these three things will always protect you from like protect you from anywhere you are going. So that thing is there. Then uniqueness of the subject, of course, like oncology, like it's a high demand for the subject, and the uniqueness of the subject is similar, because one thing is there, if after PharmD, if you're seeing some blood report or something, we will be able to understand what is the, is there any problem, like at least we will have an intuition like something is there or something is not correct. But in oncology, not everyone can comment about it. If you're seeing an oncology report, if see, after first we have to go for a biopsy, then we have to go for a histopathology, then we have to go for immunochemistry. So these terminologies are very, very, very different from the normal clinical side. So if we want to get understand oncology, means one thing, you should put time and you should read the subject, then only you will be able to understand at least the terminologies. So the even the terminologies in oncology is very, very complicated, like not complicated, it's little fancy. So that's why we need a special, like we need a what little specialty experience to understand what it is there in oncology. So that thing is also there. Then more role for clinical pharmacists due to the complexity of the treatment regimen. So I already told you, because we are using a highly, highly toxic regimens, and so all these we all know that now everyone, like now the all the chemotherapy, like the cytotoxic drugs is already gone. Like even we are using it, but now newly new therapies are coming, like what targeted therapies, and now MABs and antibody drug conjugate. So even now, even in the testing also, like if the NGS, next generation sequencing is coming. So all these things are like new targeted things and new option for, sorry, like okay, so that much new things are coming into oncology. So every day oncology is growing with it, with its complexity. Then next is board certification. I think nowadays all PharmD people are familiar with the board certified pharmacists, like oncology pharmacists, infectious disease pharmacists. So if you're going for the board certification, always the residency will always help you, because to go for the board certification and all, of course, we need experience in the particular specialty. And moreover that, like more than experience, like if you're going for residency, what is the positive part is like we are reading the subject like our therapeutics. So we are very familiar, like while doing my residency, I was very familiar with the oncology treatment, like even oncology diseases, like how we learned our therapeutics. So in the similar way, we can read it for the board certification exams also. So next slide. I think it, okay. Next slide, like rewards of oncology specialization. So this we already told, like I think from that you already able to understand, like improving patient outcomes and personal and professional growth, opportunities for specialization, contribution to advancement in cancer care. Okay, so the improving patient outcomes, like see, like that is, this is not only for the oncology thing. Like if you are going in clinical side, you can see, like if you are seeing some drug interaction, just see some drug interaction is there, and because of that patient is experiencing such and such problems. So once we identify the thing and we are just rectifying the thing while doing a proper pharmacist intervention, then from our, in front of our eyes, we can see that patient was happy, like patient is relieved from that particular interaction or the particular toxicity. So that we can see from the eyes. So that thing is there. So the improving patient outcome, and if you are doing the patient counseling properly, so and all those things, it will help to improve the patient outcome. Then another thing is personal and professional growth. Of course, the while doing residency, it will increase your value and increase the chance of getting jobs and higher payments. That is another thing. Then opportunities for specialization in oncology, we have next specialization is also there. There are certain oncology pharmacists who is specially specialized in hematology. There are in pediatric patients. There are some are experienced in pediatric oncology. So there is a huge further specialization is also possible in oncology. So that thing is also there. Then contribution to advancement in cancer care. Like if you want to pursue, like even if you are in the clinical side, we might be come up with a lot of trials and doing the trials and coordinating the trials. We will get an opportunity to coordinate all those things. Even the, you might be, it might be depend upon the job role which you are getting. If you are a clinical research coordinator, or if you are a CRA, or if you are a clinical pharmacist, little job difference will be there. Clinical pharmacist means completely different, but there are some hospitals, they are hiring like clinical pharmacist and clinical, they are just putting these two jobs together. But I won't prefer that thing properly, because clinical pharmacists have their own job role. But even though they used to what include these clinical pharmacists, like oncology clinical pharmacist, into the trials and all, because to monitor the ADRs and drug related toxicities and all. So of course we have role to play over there also, so that thing is also there. So these are the main things which I want to discuss it with you, like regarding oncology residency and all those things. So next question is like whether you want to go for the specialization in oncology, or are you liking this residency oncology and all. So first thing is like whether you are interested in oncology. That is the one question. So these are the normal things which I want to talk to my juniors. Anyone have any doubts like regarding residency or oncology specialization programs and all?
Ma'am, are there any exams before joining through residency?
Actually, currently, residency program which is only offered by JSS College of Pharmacy, Mysuru. There is no other colleges in India which is offering residency program. So for residency, currently, like I don't know, it might be changed according to like depend upon the year, and depend upon the number of participants who is like applying for the residency program. In my case, only interview was there, but that was like an online interview. That kind of interview was there. And the thing is like you have to send your CV over there, then they will choose from that particular candidates, then they will call for the interview. That is the usual routine. And it might depend upon the number of people, like candidates also, like how many people are applying for the course and all. So it might vary from person to like year to year. So I can't completely assure you that this is the process there, because that is there is no well structured things for this residency, because only 2 seats are available for oncology. Any question?
Good evening, ma'am.
Good evening.
Ma'am, do we get the stipend if we join the residency?
JSS have stipend for me. Like actually, the fees was like 3 lakhs per annum. In that 15,000 stipend will be there. Like from that means you are paying 3 lakhs, you will get 1.5 back. That is the thing. Like every month 15,000 only they are giving. That is from the fees only you will get it. Like half of the fees you will get back.
Thank you.
Good evening, ma'am.
Good evening.
Ma'am, currently how many seats are like JSS Pharmacy colleges are offering right now for oncology residency?
Only 2 seats are there.
Oh, okay, ma'am. Thank you.
Ma'am, other than oncology, which are the courses are available in?
In JSS, residency program in nephrology is there, and residency program in infectious disease also there. Like in infectious disease, first year you will be in JSS, and second year you will be in another hospital. Like it depend upon the MOU. Currently, they are going in Kochi Aster. Like that they will change, because how I'm going in Bharat, I told you, like I completed my oncology in Bharat Hospital and Institute of Oncology. Like that, for infectious disease they will send to some other hospital as like external posting, like that. Nephrology in JSS, they have a well established nephrology unit is there. So nephrology people will be posted in JSS itself, like for both the years. Any question? I think no more questions, right?
Ma'am, what is the basic pay scale for a clinical pharmacist?
It's depend upon the hospital, because it's varying depending upon the different management also. that we can't predict. Like anyway, it is near to 30, like that. Some institutions are providing even lesser. 25 to 30, that is the first thing that they used to give. Anyway, you can round it off like 20 to 30 in between. That is a fresher clinical pharmacist will get. That is the thing, range. Depend upon the institution, it will change.
Thank you, ma'am.
Ma'am, how many departments are there in JSS?
Regarding like departments in the sense like for oncology.
For residency, ma'am.
No, residency program is actually completely under pharmacy college, like JSS College of Pharmacy, pharmacy practice department. So the thing is like pharmacy practice department in college, it will be called as pharmacy practice department. In hospital, JSS hospital, it will be called as clinical pharmacy department. Actually, the thing is like same department only. When you are in college, it will be considered as PP department, pharmacy practice department. When you are in hospital, that will be clinical pharmacy department. So under the clinical pharmacy department only, this residency program is coming. Like that means the pharmacy practice department. So under that department, you have 3 subjects for residency. So it is like one department only. We are in the pharmacy practice or clinical pharmacy department. In that 3 subjects, like that. So based on your subject, you will be posted with the clinical preceptor. The clinical preceptor will be the HOD of the particular, like that means the HOD of nephrology, like your DM nephrology. Like for me, DM medical oncology consultant, senior consultant was my clinical preceptor. So like that it will come. We will be posted completely with that our consultants. They are the one who is going to ask Viva, and they are the one who is going to check your papers like exam sheets and everything. And for residency, I forgot to tell you that we have exams like every year, like PharmD only, like each year you will be having 3 internals and 1 university exam. And the like average of the 3 internals will be added with the university things, and it will finally convert it into 100. Like that it will be, like how we are doing our PharmD. Similar way, both the year they will calculate.
Ma'am, is there any other colleges offering this for residency?
Residency program is not offering by any other colleges, but fellowship program is there. Like HCG Bangalore is offering fellowship in oncopharmacy, and Sri Shankara is offering fellowship. Here Ramaya is offering oncopharmacy fellowship, and I heard like Tata Memorial is oncotherapeutics fellowship is there, which you are already aware. Then I heard like Chennai Adair Cancer Center is also having some fellowship, but that online I didn't get to know the details and all, so I didn't apply for it. Then Kochi Amrita Hospital they are doing fellowship in radio pharmaceuticals. So like that it is there.
Thank you, ma'am.
We would like to express our sincere gratitude for your insightful and inspiring guest lecture on your experiences in oncology residence and the importance of clinical pharmacists. Your expertise and passion have truly enriched our understanding of the important area of medicine. Thank you so much, ma'am.
Thank you. Thank you for having me here. And I'm so glad for interacting with a good bunch of colleagues. Thank you. Thank you for this evening. Bye. Good night.
We have now reached the end of today's session. I would like to thank all the esteemed speakers and all the participants for joining today. The feedback form is available in the chat box. Kindly fill it. Have a good day. Thank you.